am currently a survivor of infiltrating ductal carcinoma, which is a very aggressive form of breast cancer that is found in the ducts in a woman's breast.
My mother died of lung cancer in 1992, and my older brother died of lung cancer in November of 2013.
My mother had breast cancer, and my sister had ovarian cancer.
A bilateral breast cancer and a bilateral mastectomy.
I went for my mammogram, and in 1996, I think it was, is when they discovered the lump or whatever they call it.
She called me to tell me, and told me that she was scheduled for surgery, and immediately I made plans to take leave to go home to be with her on the day she had surgery, and have actually planned on being gone only for about a week, and I ended up being gone for about a month and brought her back here.
Interesting story. In February of 2013, I came home from work and I had a slight pain in my right breast. I immediately assumed it was a bad bra, and that's the truth. I kind of ignored it, went on, threw the bra away thinking it was a bad bra, said I'd never wear it again. And 2 months down the line in April, I had a coworker who was a male, and he asked to meet with me and my principal, and he said that he had been diagnosed with throat cancer. And he said to me, I ignored the signs. Had I just listened to my body a few months back, I would have been diagnosed with this a whole lot earlier. And as he was walking out the door, he says, when your body speaks, listen to it.
Well, I think that when she first went to the hospital and to the doctors, she found out alone, and then she asked for a second opinion. And that second opinion, we went with her, me and my sister at the time, and it was revealed to us then that she had a lump and that they were going to do a biopsy.
I found out I had an ultrasound and a mammogram, and the ultrasound showed that there were some nodules in the breast, but that it was probably benign, is what the report said, and to follow up in about 6 months to a year. But when I got home and I finally got the report in the mail a couple weeks later, I realized that there's just something that didn't seem right about it. There was too many nodules noted on the left breast, and being a chaplain and nurse at Good Sam, I was able to call one of my friends, a surgeon, Dr. Sandra Sanchez, and she suggested that I get an MRI. I got the MRI, and that day, within a couple days, was diagnosed after a biopsy with stage 2 invasive lobular carcinoma.
Well, I knew I had to get it taken care of right away. I wasn't in any panic or fear, because all this is things that happen in life. And I've always been a very healthy person. So I found a doctor, and he began taking more mammograms and x-rays. And then he did what he had to do.
She had radiation treatment, and she was doing pretty good, but she caught a cold, and she died 6 months later.
Now, the irony in that is, I think that he was placed by God to make me listen to my body, because before I just ignored it. That same night, I went home and the pain returned. Now, 2 months had gone by, no pain, nothing. And in the middle of the night, I sat up, and the pain at that point was excruciating. Never happened before, not that type of pain. I immediately thought about the conversation I had earlier that day with my coworker when he said, listen to your body. I called my doctor. I got the answering service. I kind of explained what was going on. And they said, okay, fine. The doctor will call you in the morning. We'll have you come in. Sure enough, the next morning, April 16th, my doctor said, just come on in. We'll take a look. Well, when I arrived, they did a routine examination, just an in-house physical exam. And the doctor said, well, let's just take a look further than this. So he sent the nurse in, and the nurse then did an ultrasound. And I kind of noticed everyone was a little busy, more so than normal. And he said, well, we're going to send you to the Women's Center of Boca to have them take a look at it. So I knew then, well, this must be a little bit more than what I was expecting. So I drove over. The staff there was amazing. They had me to undress and robe. I went through a traditional mammogram. I went through an ultrasound and a 3D. And then they said, wait. And this is all in one day. I waited for about 45 minutes and they told me to come on back, that the doctor was ready to see me. Well, I waited in the room for about 5 minutes. No one had come. And when the door came open, the doctor was in front and the nurse was behind him, and I saw a box of tissue. I immediately knew.
I was young, so I really didn't understand how strong cancer was at the time. It's not like it is now, as far as the awareness of it, and being, 17, 18 years old, not fully understanding what cancer is. To me, it was just like a cold or something. I wasn't really sure. But my mom was a very faithful woman, so she had really strong faith. And, the doctors had told her this is what's happening. And in, 6 months, we're going to come and revisit this. And so I really didn't know what to feel or what to think. I just knew that she was coming back in 6 months, and she said that she was going to be healed. And we took that into consideration and went with it.
Well, after the biopsy, it took about 4 or 5 days for the report to come back. And my friend called me and said, I don't really have good news for you. It's cancer, and you're going to need to prepare for surgery. So at that moment, the first thought in my mind was about my son Townsend. I just realized that, I think the first initial response is, how bad is it? How, where has it already progressed to other areas of my body? And there was a lot of fear and anxiety about it. But soon after that, I really, just started to pray and relied on God to help me get through it. And within a period of about 4 weeks after seeing 4 different doctors, I was scheduled for a bilateral mastectomy.
There's no secret. And when you tell your family you get support, you don't need to carry all that alone, because it can be scary. So I told my family, and they knew that I was a person that went to the doctor and took care of myself. So they supported me, they encouraged me.
Well, I originally, he had a bad cough for quite some time, and we all kept telling him he needed to go to the doctors, and he said he had been, and then he started getting the shortness of breath. I saw him outside trying to cut the yard one day, and I noticed that he wasn't doing it like he usually does it. He kept sitting down. So short time afterwards, I asked him, what was going on, and he said he had gone to the doctor and had been diagnosed with pneumonia. So I'm like, okay. So he was taking the medicine for 10 days, but 10 days later, he still wasn't better. So I went to the doctor with him, and they retreated it for another 10 days, but he really wasn't getting any better. And that second time I went to the doctors with him, I demanded that they put him in the hospital until they found out what was wrong. And that was on February 1st. February 3rd, they did surgery, and the doctor came out to tell me he was done, but that my brother had stage 4 lung cancer and had 6 months to a year to live.
I looked at him and I said, okay, how bad, how long? Those are my questions. And they kind of looked at me strange, because I guess that was a strange response. And I said, if it is breast cancer, and I can almost assume that it is. And the doctor looked at me, he said, yes, it is. I said, well, we are wasting time. What do we have to do? And I looked at the nurse and I said, I won't need those. I won't need the tissue. I'm a very strong person. I knew then that I had to prepare to tell my son. I knew that I had to prepare for my family, because I'm the oldest of 4 children. And I'm kind of used to being the one to kind of hold everyone together. I knew my mom was going to be a basket case. In that moment, all of that went through my head. And they told me that I was going to have to go through a biopsy, because there were 3 masses I had one that was just behind the nipple, and I had two that were diagonally up going underneath the armpit on the right side. About 2 days later, I went in. No, the next day. I went back. They did the biopsy, and we discovered that I was stage 3 in the largest mass, which is about 5 centimeters. I was stage 2 in the smaller masses, but I was stage 4 in between. So I was pretty bad off. And I had no symptoms outside of that one night with the pain. And then, of course, the night before. I'm extremely healthy. College athlete, college cheerleader, marched in the band. Had zero health issues my entire life until that day, April 16, 2013.
There was never a conversation of death or, different things like that. It was just, this is what we found, and we want to know more about what's happening to you. They never really, to my knowledge, addressed where it came from. My mom was very active. She was a physical education teacher, in Sarasota County for 31 years. So where it came from, where it derived from, not really sure. Not necessarily a family history of it. Other types of cancer has been in the family, but not breast cancer.
I told my mom, my family, and my son, and it was hard. I have a huge family, lots of nieces and nephews and family all over, and it was just, it's kind of shocking because I was the type of person that was healthy, taking care of everybody, running miles and taking care of myself, and never thought that I'd be the one, with cancer. So it was kind of hard.
I had radiation, and then I had chemo. But I didn't have radical chemo because they caught it in stage 1. Makes a difference, the stage they catch it in. So I never did have the kind of chemo that makes you sick and all that. And I was not went to the doctor's office and had my chemo, and it was just needles in my arm. I never did have that real radical kind. So caught it early. That's the real thing with breast cancer, to catch it early. So I came out pretty good.
It's two different feelings. With my mom, I don't know. I think I handled that a lot better than I did with my brother. I don't know, I guess my brother and I was just very close. And everywhere I went in life, my brother came. And he ended up being right across the street from me. So, it's just that closeness, I guess. Not to say I didn't love my mom. I love my mom dearly. But it affected me totally different. And I still talk about that, and how it's just different.
I knew I had a task ahead of me. 1, because of my siblings, we're very close. 2, my mom, we're very close. I'm 44, she's 60. We're very close in age. And then my 15-year-old, who was 13 at the time. Initially, I tried to hide it from my son. That worked for about 6 hours because I'm a single mom. It's just me and him. And when I came home, the first person I told was my boss, who happens to be my sorority sister. She's very strong. She looked at me. She says, "We're going to get through this." I was like, "I know we are." So then I said, "Okay, I got to call my mom." She panicked, which I expected, because most people, when they hear cancer, they think death. And the truth is, in most cases, you're going to face mortality. And so I told my mom, I said, "No, this is not what this means." Nothing inside me said death. I never once thought that I was not going to win the battle. I never once thought that I was going to succumb to anything. It's not my spirit. So from the get-go, I knew I was going to be a survivor. Sorry, I knew I was going to be a survivor. So I said to my mom, "Listen, I have breast cancer." And she said, "What did you say?" That's literally the way that I told her. I said, "Listen, I have breast cancer." And she said, "You have breast cancer?" She immediately broke down crying. Ironically, which didn't make sense to me, she started to blame herself.
She just really, I wouldn't say when they found out she wanted a second opinion, we went to a second opinion. They did a biopsy, and then they came back and told her they were going to do radiation. And at the start of that, they kind of gave us the details of what was radiation, because at this time, it wasn't as detailed once again as it is today. So she prepared for the procedure of the biopsy. She prepared for the radiation. And then once radiation was given, it was gone. And then they told her we'll follow up every 6 months to make sure that it does not come again.
I did adult and pediatric trauma for 11 years. And then I became a chaplain. So for 5 years I was working at Good Samaritan, and I was the chaplain that was on call for all the critical cases, and the one that would go on the cancer floor and pray for all the patients that were newly diagnosed. And I realized that I never had really understood how they felt or what they were going through until I got the diagnosis myself. I realized how many words I had said to them about trying to encourage them and pray for them. But it wasn't until, I got the diagnosis that I realized that I was just encouraging them, but I couldn't comprehend, I couldn't understand the pain that they had suffered. And so it really transformed my mind and my thoughts about medicine and about the care that people, receive, and also about the importance of how God was going to use this to help me impact others, because now I understand what they've been through. I had a deeper compassion and concern and care for them like I had never really had before. And until you're a patient and you go through something like that, you really don't know what people are going through.
I never thought about that. I had no instinct whatsoever about dying. I really didn't. And I wasn't in a lot of fear. So because they caught it early, I did my treatments, and I never thought negative because that feeling of fear, and I might die, that just keeps you depressed, and it's hard for the body to get well. So I kept my thoughts lifted up on expecting to be well, and I came out all right.
He was very positive. Even when they told him he had to have surgery, he said, okay, let's do it. And when we went through, after he came home from the hospital, started the chemotherapy, he was very positive. And he didn't want anybody talking negatively about it. He just dealt with it, and he did what the doctors told him. He was up walking up and down the street, getting his exercise and stuff. And so I think he was really trying to be strong for everybody too. For me and his ex-wife who was involved. There was a young lady who was involved also, and I think he was just trying to be strong and put on a brave face. Me knowing my brother, that's just how he wanted it to be.
She said, what did I do? What did I eat wrong? What did I do wrong? Did I give this to you as a mother? She immediately went in a direction that I wasn't expecting. She thought that she had done something wrong, and as a result, I ended up with breast cancer. But we later found out that it was not genetic. It was something that happened. After telling my mom, I had to tell my sister, because I'm the oldest of 4, 2 girls, 2 boys. She took it pretty hard, because then her fear became, well, if you have it, this means that I could possibly have it. At the time when I told her, I didn't know the answer. But I did tell her, listen, I'm going to do everything to make sure we can find out if this is genetic. And if so, you'll know what to do, to be tested or, to possibly prevent this. Well, in the process of telling them, my son, I tried to close the bedroom door and just have this conversation. I never close doors. We're very open. We are 2 peas in a pod. And after I got off the phone with my mom, I wasn't crying because I was afraid. I was crying because she was upset. And my son looked at me and he said, what's going on? And I said, oh, nothing. No, Mom, what's going on? So then I had to tell him. I was very honest. I knew out of the gates that I had to be honest with everyone because that's just who I am. I'm a face value person. So I sat him down and I explained to him that I had been diagnosed with breast cancer in the right breast and that I had to go through a process of getting better. He cried, but he was 13. I think he thought that, again, breast cancer meant death. And it really, in my heart, it didn't. And I explained to him that, listen, being diagnosed with breast cancer does not mean death. And that we're going to do everything we can do because I have to be here for you. You know, for the first couple of days, it was hard, but he has my spirit. So after a few days, he kind of looked at me and said, okay, so what do we have to do? And it became a we thing. What do we have to do? And I said, well, in a couple of days, I'll be meeting with a team of doctors and they'll let me know. And that's kind of where we went from there after I told everyone.
That was a totally different situation. At this time, I was an adult, well aware of what cancer was. Got a call at work one day saying that she was going to the hospital and because she didn't really feel good. She was fine, had just celebrated her 40th birthday. She's a twin. And that Monday, she called me and said they want to keep me. Okay, I'm thinking, I'm a principal at the time, and everything will be fine. Didn't know really what. She just went, to not feeling well. 2 or 3 days later, I'm at work, get a call where they've said that she has 2 weeks to live. And this is from Friday on her 48th birthday, going to the hospital on that Saturday morning to Wednesday, finding she has 2 weeks to live. She was already in stage 4 of ovarian cancer and we had no clue, and it all comes from not having a pap smear done. She had never had one. And realizing that could have saved her life if she would have just give way and went and got diagnosed and checked herself out. That was the strongest feeling of hurt and regret that I think I've ever felt, knowing that me and my sister were 15 years apart, but you have 2 weeks to live and I really don't even know what happened. So that was very hard for me.
Mine was not genetics. That was a negative when they did all the tests. Mine was estrogen positive. So it was based on the hormones. After I had the bilateral mastectomy, I had 65 staples across my chest. I decided not to do reconstruction. I felt that I was really torn about that for a while. I saw many plastic surgeons, but I realized that because I was so thin and because I did not want to go through further treatment, they were going to have to take skin off my back and my thighs and my abdomen to rebuild the breast. And for me, it just wasn't an option. I didn't want to have to go through any more suffering than I had already been through. But the greatest thing, the reason I did not end up doing it after a lot of prayer was God just told me that He was going to use this as an example for women to be able to speak about the importance of having the ability to make decisions on your own and be an advocate for yourself, and it's okay not to have the reconstruction. And the importance of the beauty from the inside out. It's not about outward appearance. It's more about what's in the heart and how we can impact other people with it. And I'm so grateful for the decision I made because I healed and recovered so much quicker than I had been if I had gone through reconstruction with the expanders and the implants and everything. So it was a decision I made, and I'm healing and I'm doing so much better now. So,
well, the first advice I would give, especially to women, is that constantly get your mammograms. And a lot of them that are young, they think they don't have to. And that is not true. Because a young lady that worked for me when I was up north, 27 years old, breast cancer killed her. So it doesn't happen to all old people like me. My best advice is to get your mammograms often and sort of try to live a healthy life as best you can. That's about the best advice, not only for cancer, but any kind of health care. A lot of what we take into our bodies, that helps everything. That's it.
He smoked. And I think he started smoking when he went into the service, which I did too. but he worked the kind of job that required him to do shift work. So for him, he couldn't sleep, so he smoked. And it was just, had gotten up to like 2 packs of cigarettes a day, which is ridiculous to me. But anyway, I think it was a combination of, the smoking and not sleeping properly. I think all of it takes a toll on the body.
I do believe it does have something to do with how you treat your body. It has something to do with how, what you eat, how you exercise, how much stress you're under. I have friends that have lost both bosoms because she's had breast cancer, and they tell her, number one, you cannot be stressed. Stress will cause it to come back. She's been through it, so this is not my first battle with it. It's just kind of watching the patterns that people around me have that have encountered cancer, and, and seeing the who, what, why, how, and seeing how, but I definitely think it affects it.
To have your family and friends there beside you to love you and tell you that it's going to be okay, I really couldn't have gotten through without that support. I had friends, Erin came from Tampa, Beth came from Vero Beach. I had friends from high school calling me. My sister flew from Atlanta. It seemed like we had people coming in this house from the church and from the hospital just on a daily basis, just bringing food and checking in on me. And it was, the most humbling thing of it all was, I didn't realize how much I was loved. It's like all I did was want to care for everybody else. I cared about people's family. I was the chaplain in the ICU praying for these people who were dying. And then all of a sudden, everybody's here, just giving back. And I remember even the day of my surgery, I had decided that I was going into that operating room praising God. And we had probably 60 people come, pastors from different churches. People just came and in the chapel and just prayed with me. For hours before my surgery. It was like people were standing outside in the hall, just wanting to say, I'm here and I understand and it's going to be okay. And it was the greatest experience. I wouldn't say I would do it again or I wish this on anybody, but it really made me realize what life is about and how important it is and how the little things in life, it doesn't matter. What's important is your family and your life and God and your strength that God gives you. There's some things in life you don't think you could ever get through, but you do get through it. You're stronger than you think you are, and that's what I realized.
I wouldn't want anybody to face that without support. The first thing that comes in a person's mind, I'm going to die. It's so scary. And you need family, friends, church members, co-workers, all the support you can get. Very, very. My family was very supportive.
It was just, it looks like he's getting worse, that kind of thing. But especially when, he didn't like air conditioning. You'd walk in the house and it'd be 90 degrees inside the house and he'd be cold. And just sleeping all the time. And we knew, but we just couldn't say it,
The first thing I say is learn your body, especially to a young lady, to a young woman, to even an older lady. Learn your body. Learn, every night in the shower, I check myself and make sure there's nothing that feels different than yesterday. I always am pushing to make sure that not just me, but my other sisters are getting those pap smears, those annual. We don't miss those things because early detection is key, because that can be the factor of living or dying, by getting it early. And I think that taking care of your body, and watching what you do, how you do, is key. So learning your body, learning different, foods that, will help, will not help, eating those vegetables, exercising, getting those things in your daily practice will help. Will it cure it? I'm not a doctor, but it's a great path to make sure that you're working towards preventing it. So that's what I would suggest. Men, there's all kinds of cancer out there for men. I say the same thing. Get those annuals. I mean, that's so key. A lot of men don't think they can get breast cancer, but they can. There's breast cancer out there for men. There's those colon cancer, lung cancer, all those things and things that we do to tear our body down. If we can stop doing those things, that helps us. Men and women, doesn't matter, because guess what? Cancer doesn't have a name on it. It comes to anyone who's open to it. And if you're not taking care of your body, you're leaving yourself open for anything that can come in.
I know what it is to be broken and be bold. Tell you that my silver is gold.
It says, those who live in the shelter of the Most High will find rest in the shadow of the Almighty. This I declare about the Lord. He alone is my refuge, my place of safety. He is my God, and I trust him. For he will rescue you from every trap and protect you from deadly disease. He will cover you with his feathers.
Shooting across the sky like a star, but no